Safety Collaborative was first set up in 2011 following a conversation with Sir Ian Carruthers, who was the Chief Executive of the South West Strategic Health Authority at the time, who asked if we could start to think about how we might set up a programme to support the ongoing development of safety awareness and safety improvement in mental health. We'd got the collaborative set up through physical health at the time, and it was Sir Ian's great vision that allowed us to set that up for mental health.
This initiative is about reducing violence and aggression on a dementia ward. So this is a very specialised unit for people with severe dementia and behaviour that challenges, and incidents of violence and aggression were actually increasing.
Without the support and being introduced to the Patient Safety Collaborative, I wouldn't have initiated any improvement projects. Following every Patient Safety Collaborative I attend, I always come back feeling that I've gained more experience and knowledge of improvement methodology, and it helps me to improve the patient safety project on the ward. So the main challenge I faced implementing this project was changing the culture on the ward. Some of the staff have been working on this ward for 20 years plus, and they've been using the same paperwork for that time, and nothing had changed.
The main impact of the project was to look at our observations and how they can work and be better. So how we can actually use them to inform our care planning and to improve the care and treatment of the patients on the ward.
Probably the reduction in violence on the dementia ward of about 30% has been the most striking change. Staff are less likely to be hurt whilst they're at work. That reduces sickness, and that not only helps us with our budgets, but actually provides a more continuous staff group who are then able to respond to the patients in a more personalised way as a result of that continuity.
David is calmer, which makes me feel a little bit more settled, and I'm assured that David is in a really good place here.
The 4 Steps to Safety project is a violence reduction programme. It originated as a pilot within South London and Maudsley Trust. They had identified that because violence and aggression is the #1 reported incident within mental health trusts, that it was something that needed to be addressed.
The 2 main challenges this project's created are, firstly, that it's been really difficult to change the culture. People have really struggled with new ways of working. Secondly, the other big challenge is really helping people to understand that it's the key to really good care is about proactively engaging our service users rather than necessarily just observing them. The collaboratives really helped us because from sharing experiences from other trusts and lots of other people, we start to really gain their experiences and help utilise them to form our own care packages. And the main thing we find is that having a systematic approach to change has really helped us.
In January 2016, we were recording 4 incidents on average a month on the ward, and in January this year we had none. So I think that's a great improvement.
The project hasn't finished yet, there's still another 6 months to go. So in terms of impact, it's a little bit too early to make any concrete conclusions. However, we do know that reporting has gone up, as we would have expected, as people become more safety aware. But also we've noticed the positive impact that severity of harm has reduced.
The issue that we faced was that we had large numbers of falls, particularly with people diagnosed with dementia, and when they were falling they were harming themselves in terms of fractured neck of femurs and quite serious injuries, and then their life expectancy was drastically reduced as a result. The collaborative helped by giving us guidance on the use of PDSA cycles, how to measure the situation before and after we'd implemented the changes. We resolved our slip, trips and falls by the implementation of small projects which were easy to implement by the staff of the ward and easy to monitor using PDSA cycles. One of the great things about the collaborative is it's given us a good platform and a forum to be able to share those ideas that we've implemented so other trusts can use them. The impact has been we achieved the 50% reduction in harmful falls within the first year, and went on then to achieve that again in the second year. We saw a dramatic improvement in patient safety. We found there was an overwhelming engagement from the staff based on the success of the implementations we tried, and the general attitude changed and people were much more encouraged to come forward with ideas which we could then try.
Missed doses and medicines not being available is a real problem to people who use our services, because what it means is people aren't getting the medicines that they need at the right time. We then installed a robot here in Sewing Borders to help us with our storage issue, to make sure we could keep the right amount of medicines and make them available. We also use the robot to make sure that we pick the right medicines, and we also use the robot to release the right medicines out of hours. Some of the interventions that we borrowed from the collaborative include rationalising the medicines chart, so that making sure that all the administration times aren't loaded on the morning, making it a really long drug round, to making sure that the administration times are spaced out during the day.
We've really adopted the quality improvement approaches, particularly the plan